You're listening to Ruminating with RealAg with Debra Murphy on RealAgriculture.com.
Well, it's nearly May and many of us are in the throes of calving season. For some, that will mean battling scours. That's why today we're talking to Cody Creelman, large animal veterinarian and social media guru. Hello, Cody.
Hi, how are you?
Pretty good. Let's start with the basics. What is scours?
Okay, well, Scours is just the lay term or the producer term for neonatal diarrhea, typically reserved for cattle.
Okay, are you hearing much of scours this year?
Oh my goodness, yes.
It seems like every year.
I wouldn't. Yeah, every year for sure, and we're definitely in the throes of scour season again. I wouldn't necessarily say it's worse than any other year or better than any other year. I think one of the main factors is calves are just worth so much more this year. So we're definitely hearing about more calls and doing more case workup on different outbreaks, just because the value of the animals is that much more significant. Guys have been getting us on board a lot quicker in the disease process.
So there are a few different types or causal agents of scours. Can you tell us a bit about them?
Yeah, for sure. So the main ones are either viral or bacterial, and there's also a couple parasites, or you could put them in the parasite category. So the first two are out of the viral are rotavirus and coronavirus. And then we move into the bacterial, which would be E. coli and rarely Salmonella. And then on the parasite side, we have Cryptosporidius and coccidiosis.
Is it important to know the differences between all of those?
Absolutely. So they're from our perspective as veterinarians, there definitely is on recommendations, but from a producer standpoint as well, just in how we're going to treat, what the overall implications are going to be, and how we can control those pathogens in preceding years if we do have an outbreak type situation. Things that we can do to control the different factors that cause scours, or the different risk factors.
For sure. So I guess maybe we should just talk a little bit about that. How can we tell the differences?
Well, one of the main ones we do when we're just getting some cursory information is timing. So different viruses and different bacteria have a different timeline of what age of calf they like to affect. So to keep it simple, in baby calves, it's usually the virals right up front. We can have E. coli, the bacterials sort of throughout. Sometimes it can happen really, really fast. Sometimes those calves are past 10 days of age. And then in the coccidiosis one, those calves are typically 21 days, although there is some species of coccidia that can cause clinical disease a little earlier. So that's definitely the main one that we lean on, is just what age of calf do we have, and it kind of guides our thoughts on what potential disease is affecting those calves. Mm-hmm. But that said, sometimes we get in a situation where it's not necessarily clear. It's not hard and fast. We're dealing with biology at the end of the day, and there can be a lot of variation. So what we end up doing, if we're getting into a situation where we're not sure what disease or what pathogens are causing the disease, we'll actually send off samples. So we can send off samples of feces into the lab. We can also, if we have any animals that are actually succumb to that disease, we can send away samples of their small intestine and large intestine and get those tested as well. There is some chute side diagnostics that are becoming more and more popular. So basically, where producers can take a fecal sample, or a veterinarian can take a fecal sample and try to get a rapid analysis of what exactly is going on. The sensitivity, so the overall diagnostic value of that isn't quite as high as if you send off to a lab, but it can definitely guide us in the right direction as well.
Is the cost of those technologies coming down? Is it going to be cost effective for producers to have them?
Well, when we get into diarrhea, the economic implications can be huge just from setting back calves in terms of overall weaning weight. So really, even the cost that it is now, or even in the past, it has always been economical to try to get a handle on what exactly is going on in your herd, just with the overall value of the animals. But yes, the cost definitely is going down. Even with the lab samples, there's more and more technology coming in. One would be PCR, so that's the ability to actually just pick up on the DNA of the pathogen, as opposed to actually having to use markers to find those viruses or bacteria. We can just actually look for their DNA rapidly, and that technology is a lot cheaper as well.
Is it okay to rely on just the appearance of the scours themselves? Are the symptoms different enough in that regard, or?
They can be at times, but it can be a red herring, and you can end up treating for diseases that don't exist based on that. So it can help. It helps guide you, but it definitely isn't a hard and fast rule.
For sure. So what's the first thing that producers should do if they suspect scours in a calf?
Well, the first one is definitely treat for dehydration. So the majority of the time, the infectious agent isn't trying to kill the calf. It wants to stay alive too. It wants to shed all of its viral or bacterial particles and be able to reproduce. So it's not trying to kill the host by any means. But what does happen is when you slough off a lot of the villi or the water absorbing tissue that gets infected, the calf is no longer able to absorb as much water as it should. And that's when the diarrhea starts, and that causes very severe dehydration. And it's the dehydration that usually the animal succumbs to. So treating the dehydration is usually enough to get a calf through the worst part of the scours until it can mount an immune response to whichever organism is affecting it and get on its way. So the top one is definitely getting on rehydration as quick as possible, being able to recognize the signs of dehydration and managing that appropriately. So actually giving enough fluids until that calf is no longer clinical or no longer has scours is very, very important.
So remind us.
When it comes to... Oh, sorry, go ahead.
I was just going to say, so remind us some of the symptoms of dehydration.
Okay, so the main ones that we see are skin tenting, so you can actually pinch the calf's neck and see the skin stays, so the skin isn't as elastic. And then the next one is eye sink, so the calf in a certain stage dehydration, its eyes will actually sink back in its head. And then the other one that we also refer to is just how well that calf is doing in terms of depression. So usually the calves will look a little wobbly, but they'll still be able to nurse. And then they'll look more and more wobbly. They may or may not choose to nurse, and their suckle reflex will decrease. So if you put your finger in a calf's mouth and it's not suckling, then that's another indication that dehydration is getting even more severe. Then what happens is we fall into acidosis. So when we get a certain level of dehydration, we also get a buildup of acid in the bloodstream, and that causes very severe depression. So that's what causes those calves to actually go down. So we'll see calves that are getting weak, losing their suckle response, and also going down into what we call sternal recumbency, so just laying on their chest. And then some of those calves actually end up being flat out because the level of acid in their bloodstream is so high. So we can treat to a certain extent with oral electrolytes. So this is the oral rehydration solutions that we tube or bottle feed. We can do a lot. We can treat a lot of dehydration with that, and we can also to a certain extent treat acidosis. But once those calves are recumbent, so laying down and no longer have a suckle response, it becomes very, very difficult for a producer to rehydrate that calf just using oral electrolytes. And that's usually when the veterinarian comes in to provide IV therapy or intravenous hydration and electrolytes, and also a correcting of that acid buildup in the bloodstream as well.
Right. So if it's just in the beginning stages of dehydration, how much electrolytes, how much fluid should we be trying to get into that calf?
Right. So it does depend on the type of solution that you're using. So in our practice, we typically use products called Revive or Calf Light. Mm-hmm. And what we do, if you're noticing diarrhea and a mild dehydration, what you need to do is treat with 2 liters of that electrolyte solution twice daily. And you would do that for 2 to 3 days, depending how severe it is. And then switch to 2 liters once daily until the manure comes back to a normal or at least a pasty consistency. And that's just based off of, so that the 2 liters is just based off of the label claim for the Revive and the Calf Light. So regardless of the electrolyte solution that you use, it's important to follow that label. Yep. To guide your therapy, and then also on the recommendation of your vet as well. But in general, 2 liters twice daily can usually correct most mild cases. When it comes to calves that are very depressed and dehydrated, but still able to stand, so they're not in that lay down phase, then what we do is we end up going to 2 liters of electrolyte 3 to 4 times daily for the first 1 to 2 days. And the other not little important thing, but the other important thing is those calves still need to be getting a milk diet on top of that. So it's important to try to alternate milk feedings with electrolyte feedings, even if those calves aren't wanting to willingly nurse, because to get calories into their body is also just as equally important. So you might have to split up those milk feedings into smaller feedings, but they still need to be getting a normal milk intake overall throughout their treatment period.
There used to be electrolyte formulations that required milk withdrawal. Are those still on the marketplace, or should we be watching out for those labels too?
Yes, you should absolutely be looking out for those. The majority of the ones that you would get at your vet clinic, and the majority of the ones at the farm store, you don't need to worry about. Those were the older formulations, and I'm not even sure if you could find ones that needed milk taken away. But the majority of the modern electrolyte therapies definitely do not require that.
At what point do we have to intervene with some sort of medical treatment?
Yeah, so the main medical treatment, I guess, just oral rehydration technically is a medical treatment. The next step definitely is an intravenous fluid therapy. So that's when those calves are depressed and unable to stand. At that point, that's definitely when a veterinarian can come in and provide that additional boost. What we do in our practice is a combination of bicarb, so an actual a basic solution that allows for us to correct for that acidosis, or hypertonic saline, so the ability to rehydrate those calves more quickly than could be accomplished with oral therapy. And then there's also the traditional slow drip, which still works very, very well. We just don't seem to do it in our practice as well either. One of the new ones in terms of therapy is the addition of an anti-inflammatory. So meloxicam would be the drug name, the active ingredient. One of the brand names would be Medicam, and that actually has a diarrhea claim on it now. And what that does is it decreases the inflammation in the gut and allows for overall better absorption. And there's quite a few studies out there showing that calves that receive a single dose of anti-inflammatory during a diarrhea outbreak actually have better growth overall and are able to absorb nutrients quicker. So that's definitely a good thing. The last one, well, not quite the last one, but the controversial one is when do we intervene with antibiotics? So what we had first talked about was we have a viral component, and we have a parasitic component, and we have a bacterial component. If we do have bacterial scours, there definitely is merit to treating with an antibiotic to make those calves respond and feel better. With E. coli, scours are very, very serious and absolutely do need antibiotic intervention. What typically happens on the farm, or at least it had happened historically, was any calves that get diarrhea would also get an antibiotic as well. That may have been warranted, and it may not have been warranted depending on what that is. So antibiotics actually don't do anything for viruses. There is some theories that these calves are immunocompromised, so have a poor immune system, may be susceptible to getting infection from other routes. So having an antibiotic on board during that time could be beneficial, but it really isn't prudent antimicrobial use. So it's quite frowned upon to give antibiotics unless we have an actual diagnosis and a reason to put those on board as well. But with calves being at record prices, producers are a little more keen to try everything, and sometimes the shotgun approach of treating with fluids and antibiotics and anti-inflammatories could occur, and you really have to work with your veterinarian to make sure that you're tailoring that therapy for the exact pathogen that we're trying to manage. And the only way to really get a good handle on that is to send samples away and try to get an accurate diagnosis.
Mm-hmm. Yeah, either of those many methods it takes forever. So I guess that's where we come back to prevention. It seems to be key with most of the illnesses that we see on the farm. How can we prevent scour outbreaks?
Oh, absolutely. This is really the only way that we can manage it is preventing them in the first place. Once scour starts up in a herd for that year, it can be very difficult to manage. So you're just in triage mode, treating calves that are becoming dehydrated and trying to manage them and save them. But it really is a disease of management. Mm-hmm. So the individual risk factors, definitely are the age of the calf, what type of pathogen you have, what the immunity of that calf is. So did it get accurate or an adequate amount of colostrum and a good quality of colostrum when it was born? What that environment actually looks like, so what that level of contamination is. Are you calving in a muck hole, or are you calving out on a nice dry pasture?
And maybe I'll just stop you there. How long will scours pathogens exist in the soil?
Yeah, so the soil really isn't a concern. Something like Coccidia, definitely that's one of the parasitic ones. That one can last for a very long time. Some of the bacterial ones, they can last in the herd. So in, say, the mothers, without causing clinical disease. So they can be propagated and passed and kept in the herd for years and years. One example would be Salmonella. That one can actually even be just in the environment because it's in a population of birds. So it can be quite complex. When it comes to viruses, the viruses don't last at all. Mm-hmm. They have a very short lifespan outside of that animal's body. So carrying that over to the next year is quite rare. But what can happen is that it's propagated through that mature cow herd throughout the year without causing an issue in those older animals, because their immune system is very good and the challenge level isn't that high. But come calving season, then that virus can be shed again, or that bacteria can be shed again, and that causes the problem all over.
Okay.
So yeah, the actual environment level of contamination isn't, from year to year, isn't a concern. It's more what type of situation, how dense of calving area are we looking at? Yeah. And the contamination that way.
Sure. So we need a clean calving area that's not too crowded. That calf needs colostrum right off the bat, and good quality colostrum.
That's right.
And what else?
Definitely just overall making sure that the cow herd is getting an adequate level of nutrition. Poor nutrition leads to poor colostrum and can decrease that calf foot immunity. And things like just general husbandry, that weaker calves that have had a difficult birth, they need more care and attention. Calves that just overall need a little more help in getting that adequate amount of colostrum. So if you're focusing on your calving area, you're focusing on those calves getting colostrum, an adequate amount of colostrum, and helping the ones that may not be able to get that on their own, you're going a very, very long ways into preventing scours overall.
Sure.
One of the other things that you can do to help that in terms of prevention is actual vaccination. So there is Scours vaccine out there provided through a variety of different companies, where you can dose those cows while that calf is still in utero, is still in its mom, and it boosts the colostrum antibodies for some of those specific pathogens. Some producers choose to just do their heifer herd, just because overall, in general, heifer colostrum isn't quite as good a quality. So we're trying to provide those calves born to heifers or young moms with the best available options. But there are some herds where they've always had issues with colostrum, and they choose to vaccinate the entire herd overall. So just in general, some of the things that the scour vaccine protects against are the viruses. So it has rodent coronavirus in it. It also has E. coli, and it also has another bacteria called Clostridium perfringens as well. So that's just boosting that colostrum. But it definitely is not a Band-Aid for that general husbandry and good management during calving season.
That was large animal veterinarian Dr. Cody Creelman. As always, you can find Ruminating with RealAg on iTunes, or of course on our site, realagriculture.com, where you can also find the beef market update. And if you haven't listened to it, I highly suggest you do. My name is Debra Murphy. If you have any feedback, or you would like a future episode to be geared towards a topic of your choice, give me an email, dmurphy@realagriculture.com, or send me a tweet. I'm at realag_Debra. Thank you once again so much for listening, and until next time, keep ruminating.